This patient was referred to me about 2 years ago for endodontic retreatment of tooth number 30. This root canal was done in China a couple of years prior. I, I can't call it a root canal. I can only call it a root canal because I can see stuff in the root, two roots, but anyways, patient had symptoms. You can see a periapical lucency here. This was the condition of the tooth 2 years ago. Here's the date. So we discussed options with the patient, and patient decided that she wanted to try to see if tooth could be saved by redoing the root canal. So that's what we did. We redid this root canal for her in one appointment. And this was immediately after we had redone the root canal for her. And look how many canals this dentist had missed, how much anatomy this dentist had missed. And here's the date, as you can see. Here it is, 2022, so about 2 years ago. So this was immediately after we had redone the root canal. Again, this is another angulation. And another angulation. This is immediately after we had redone the root canal. Look at all of this anatomy that this dentist had missed. And here's the date, again, as you can see. And this was just a few days ago. Patient came in, so we can examine tooth number 29 and take a look at tooth number 30 that we had redone the root canal almost 2 years ago. That periapical lucency is healed completely. Tooth has a crown on it now. Patient has no symptoms. Tooth is in full function. And here's the date, as you can see. So 2 years post-op of tooth number 30. So we went from that 2 years ago to this just a few days ago. 2 years post-op of tooth number 30. You can see that large periapical lucency healed completely. You can see sealer extrusion that I had did not cause the endodontic retreatment to fail. 2 years post-op of tooth number 30. And again, here's the date. Also, we redid this root canal in one appointment. And redoing the root canal in one appointment did not cause the endodontic retreatment to fail. So we redid the root canal in one appointment, and we had some sealer extrusion, or sealer puffs, we call them. They did not negatively affect the outcome of the endodontic retreatment. Another example. I've posted hundreds of these cases and examples. And of course, it's all backed up by research as well, multiple research. So 2 years ago, again, you can see the date right there, and just a few days ago. And again, here's the date. 2 years post-op of tooth number 30 right there. This patient was referred to me for endodontic treatment of tooth number 29. She received a filling here, and afterwards tooth started to hurt a lot. Tooth was sensitive to heat, cold, and biting. And she went back and saw her dentist, and her dentist referred her to us for examination and root canal, and we found the tooth to be in state of irreversible pulpitis with acute apical periodontitis. So today we went ahead and did the root canal for this patient. By the way, this is the same patient. I redid the root canal on tooth number 30 that I presented in the previous video 2 years ago, and this would be the two-year post-op of tooth number 30 today. But take a look at tooth number 29 that we worked on today. And here's the post-op. Look at all of this anatomy here. You got a lateral here and a puff you can see there. And look at all of this. Look at all of these portals of exit. And of course, again, lateral there. This is three-dimensional instrumentation, irrigation, activation, and obturation. We temporize the tooth and refer the patient back to our dentist for the permanent restoration. And here is 6 months post-op of tooth number 29 and 2 years, 7 months post-op of tooth number 30 of this patient that I just presented. Patient came in yesterday for me to look at a couple of different teeth, and of course we always take x-rays of the teeth that we have done work on them, and here it is, and here's the date, as you can see. So 6 months post-op of tooth number 29. As you can see, tooth is in full function, has a crown on it, in full function, asymptomatic, no periapical lucencies whatsoever. Sealer extrusion, or if this is gutta-percha extrusion, as you can see, had no effect, negative effect on the outcome of the endodontic treatment. And here is 2 years, 6 months post-op of tooth number 30. The periapical relucencies healed, as you can see, completely, as I presented in the earlier video. And as you can see, sealer extrusion has had no negative effect on the outcome of the endodontic retreatment of this tooth. By the way, remember, we redid this root canal, redid the root canal on this tooth in one appointment, and look at how many canals this dentist had missed. But anyways, one appointment, endodontic retreatment, and this is its 2 years, 7 months post-op. Tooth has a crown, in full function, asymptomatic periapical lucencies healed, and this is 6 months post-op of tooth number 29 of this patient. And again, here is the date. Patient's getting braces now. So root canals have a very high success rate if they're done properly. Sometimes we have to redo them. I've had cases where I had to redo my own root canals, and that's not because I'm not good at the procedure. It's because a lot of times we're dealing with bacteria, we're dealing with microorganisms and their products, byproducts, toxins that they produce. And sometimes these bacteria and their toxins, they're extremely difficult to eradicate. Also, sometimes bacteria are residing within the canals, and sometimes they're actually outside of the canals on the root surfaces, outer root surfaces of these teeth. So no matter how many times we redo the root canals, the problem is not inside, the problem is actually outside on the root surface of the tooth, on the outer surface of the root. Does that make sense? So sometimes in more favorable places, we do apicals in these situations, or patient just chooses to extract the tooth. All right. But in general, root canals and root canal retreatments have a very high success rate. Pretty much the same success rate as if you extract a tooth and place a dental implant. The success rate is pretty much the same as extracting the tooth and placing a dental implant. So make sure whoever does your root canals or redo your root canals, make sure they know what they're doing. All right. Usually we like to go to an endodontist, someone like me, for these types of procedures.